very much, Frank. Thank you very much, Frank. Our next guest was here last October before undergoing the lap band surgery via robotics.
He has lost some weight. It's been 6 months. He's got a new haircut. Joining us this morning, Steve Sanchez and his bariatric surgeon, Dr. Lou, to give us his progress. He's live here in studio. In fact, Steve, stand up with me because this is a changed man. How much weight have you lost?
102 pounds.
Hey, you lost to Jessica. Go ahead, have a seat. How are you feeling, first of all?
I feel good. Yeah, more energy. I sleep better. Just everything's a lot better. My legs don't hurt as much as more.
Dr. Lou, 6 months out, 100 pounds. Is that about the progress that you wanted to see?
It's a terrific weight loss. Steve has to be congratulated on doing a terrific job of dieting and exercising along with the lap band that was placed robotically. He's lost 102 of these. This is exactly a pound
of fat.
That's
just creepy. Look at that pound of fat right there.
Need 100 of these.
102, yeah.
Now, you do it with, like you said, robotics. Why robotics, and what's the difference, the advantages, and how does that work?
Well, robotics is great for really big people, so it saves my back, basically. It makes my surgery a little bit more accurate. I don't have to be standing there over the patient, and it really makes the surgery much more accurate.
Wow.
Now, in terms of his progress from here, what is your ultimate goal, Steve?
My ultimate goal is shooting high would be like 200 pounds.
Okay. Because you're a big guy. You're tall. You're what, 6?
6 foot.
Yeah. So that would take him at the rate he's going. How long?
Probably another year and a half, I'd imagine.
Okay. And are you committed to that? A year and a half
with
it?
Yeah.
And doctor, how can we sometimes see people that do get this procedure done, they actually fall back. They end up gaining some weight back. It's hard to do with the lap band, isn't it?
It is, but if you don't have the band continuously adjusted, you will gain back some weight if you fall back into your old eating habits. Steve has pretty much given up a lot of the starchy foods. He's given up bread and pasta and rice.
Do you miss that?
Sometimes.
But is it easy enough to stick to the workout, the new diet?
I use it as a tool to help me.
Okay.
Do you wear it permanently then, or is it at some point you remove it?
It's optional for the patient to remove it at some point in the future, but most people like to keep it in for as long as possible, and it has not failed since I started putting them in 2002.
What are you thinking, Steve?
As long as possible.
As long as possible?
Yeah.
And how's the family feeling?
Good. Everybody's happy. Excited. Even with the results too, everybody's can't believe in 6 months that I lost that.
You lost it, Jessica, 102 pounds.
Good for you.
Congratulations. Can I take your hand? Way to go.
Thank you.
And Dr. Lou, thank you so much. To learn more about Dr. Carson Lou and the Da Vinci surgical system that you might have seen on Grey's Anatomy once, go to KTLA.com. Congratulations, Steve. Thank you, Dr. Lou, for coming back to visit us.
Thank you.
Up next, our Hotlanta Day continues.
Hotlanta.
We've got an NFL